All right, welcome again to the Forever Forward podcast. I'm your host, Damon Goddard, and I appreciate you guys listening, watching, however way you're using this through your social outlets. I appreciate you guys logging in. And today's guest, Dr. Anthony Lyssy, is going to be an amazing guest to have. He's number one, he's my personal physician that's taken care of me for a long time, and really has helped me to physically, mentally, nutritionally navigate a lot of the day-to-day stressors that I feel. And we're going to dive deep into a lot of discussions, but the premise of this particular podcast, once again, is just to take that one step forward, past that threshold. And the idea is, we've got a lot of mental thresholds, physical thresholds, but we're not looking from A to Z. I'm looking from A to B. Just, give me the inspiration to just give me one step to keep moving forward. And that's that forever forward mindset, is to simply just keep moving forward. And it just requires that one step. So let alone a lot of our guests, we have inspirational stories of how they've overcome those valleys. But also this is a podcast where we equip you with the instruments to help you navigate through those times. And listen, we're all dealing with a lot of stress. We're all dealing with, a lot of different things. I mean, that maybe inhibiting our performance, maybe inhibiting our sleep, increasing our stress. And so Dr. Lyssy is going to be here today just to kind of help us navigate and equip us with some of these tools. And a little background on Dr. Lyssy, he was a graduate at the University of Texas, so hook 'em horns. Did his medical degree through University of North Texas and the Health Science Center. Board certified through, did his board certification through Methodist Hospital in Dallas. He's functional and integrative medical training right now has really set him apart, and he's changed and shifted the paradigm of the medical model right now. And so that's why he and Ha really well is we think of things a little bit different from the preventative side rather than so much reactive. And so especially when I'm dealing with my athletes, I want to look into the looking glass in the future to see what's going on and how we can mitigate the potential of injury. And so Dr. Lyssy does this on the medical model side. So Dr. Lyssy, I appreciate you joining us and being here with us. And so let's just jump into it. Give me a little bit of background on what we're doing right now from a medical model standpoint, what you do on a day-to-day operation, and how you got into this Dr. Lyssy's wellness right now.
Yeah, well, I appreciate you having me on, and this is exciting. This is something we've talked about doing for a while, and I love the initiative that you've taken to create podcasts like this for people to not only enjoy but also learn from and better themselves one step at a time, as you like to put forth there. So, what am I doing and how am I doing it? Always take a step back and talk about my passions. As I was training in medical school and in residency, I saw what was out there, and I saw what the traditional medical model brought for many. And unfortunately, it's just woefully inadequate. And the downstream effects, the downstream approach is just not going to get the job done. We're putting Band-Aids on people across the board, and when we really need to be focusing upstream on what's causing a lot of these medical issues. And there's so many issues that are multifaceted. And it's not just as simple as, I always use a strep throat example. Hey, you've got strep. Here's your antibiotic. That's going to treat the infection. Great. If all medicine were that simple, then the traditional model would work.
Yeah.
But unfortunately, it's not, and it doesn't. When I was training, I saw the way that things should not be done. And that's always, for me, been really motivating to say, look, whatever, I don't know what I'm going to do, but whatever I'm not going to do is that. And that really started spurring me on to look at other options and to say, how could I better my practice so my patients can be better for it? Yeah. It's really how everything started. And, I always look at improving myself and what I do. And so when I came out of training, as you mentioned, I did go to UT, and then I went to medical school in Fort Worth at North Texas Health Science Center. And then I trained at Methodist Hospital, board certified in family medicine. And that was kind of my base, right? And then I added on the first step, which was what we call arteriology, or the study of heart attacks and strokes and how we can prevent them inside the walls of the artery where disease begins. Mm-hmm. And that really got me looking at, wow, there's so many better ways to practice medicine, and it's all evidence-based, and it's all data-driven. And we can really, as you mentioned earlier, take a glimpse into the future and say, what can we be doing now that's going to pay dividends, in 5-10 years, rather than wait for those things to happen and then us have to fix it on the back end. So that was my first really foray into kind of the preventative functional look at things. And then I use that to kind of springboard me into the functional and integrative medicine model. And so, Institute of Functional Medicine does a phenomenal job training physicians on how exactly to do this and how to look at a patient from all sides, and how to use great data, functional data, look at inflammation, look at hormones, look at the microbiome, right, the delicate balance of good and bad bacteria in our digestive tract. Put it all together and then listen to your patient, listen to what they're telling you, listen to what they've been through, listen to what they're at risk for, use all that data together, and then just start coming up with a plan. And that plan is living and breathing. It grows. Yeah. We audible. We change things. We use data to shift, where my model allows me to be in constant communication with my patient. So if we get all that data and I have my plan, and for some reason that's not working and we hit a barrier, I don't have to wait 3 months to see them again. I know right away, and we can shift very quickly. And that keeps us adapting, and that keeps our patients benefiting. So that's really why, the how. I run kind of two sides to my practice. I do a lot of wellness consulting at Dr. Lyssy Wellness. And, it's essentially people come in and they use me as their wellness consultant. They may not need a primary care doc if they're young and healthy and just want to optimize, or maybe they have a primary care doc, but they don't do much functional medicine. So they then use me as kind of that guy. So we do a lot of testing up front, and then we kind of have a year-long period where we work together to really tune them up. And then they may be done with me happy, or they may then shift into more of my wellness membership model, which is kind of like a wellness concierge medicine, right? They've got access to me when they need me, but we're still hitting all those facets of wellness, and we're exchanging regular emails and texts and calls and having regular face-to-faces or telemedicine now, with obviously the way things have changed. Yeah. And we're still hitting all of our metrics. We're talking about, my real pillars of functional health, which is, our recovery, our regeneration, our sleep, our cellular aging or lack thereof, hopefully. We're talking about nutrition, obviously, which is kind of the cornerstone of everything. Food is information for our body. And then we obviously talk about our activity. And there's so many things that are kind of one-offs of those. And, everybody's different. Everybody has different requirements of them. Everybody has different barriers. Everybody has different genetics. And that's one of my take-home points for people is that, look, I can do the same thing for a lot of people as far as my diagnostics, but I don't think I've ever done the same thing for more than one person as far as my treatment plan. Everything's personalized based on what they're telling me, what I'm seeing on the data, and then what they're at risk for. Genetics are big, but we also know we have epigenetics, right? That's the idea that genes have kind of light switches, on and off switches. Yeah. And we can turn those switches on and off based on the things that we do on a day-to-day basis, right? What we eat, how much we sleep, or how good our sleep is, how much stress we're under, how active we are. And so that's the thing I want people to understand is that, look, genetically you may be predisposed to something, but that doesn't mean you're going to have it, right? We can turn those switches on and off. And that's kind of the whole ball of wax, so to speak, as far as how I work with people, a very personalized approach. And we just dig in and we use data to allow us to say, okay, look, my clinical suspicion is this, and then this data supports it. So let's go ahead and apply some changes to it. And it's a science, but it's also an art, right? I mean, things are very much, hey, look, we're going to try this. It may or may not work, and then we'll go to the next step if needed. And that's where my plans kind of evolve to see, how it's working, how it's not. And so that's how I got into it, what I do, kind of a high-level view. Yeah. And it's fun. I see people get better. It's the same thing you do with your clients. Look, you figure out, I remember the first time, I started working with you on some stuff, and you're like, okay, hang on now. We got to talk about your big toe. And I was like, my big toe? I just want to come in here and make gains, right? But he's like, no, we got to get everything moving the right way. This is all connected. And so that's why I knew right away. I was like, wow, this guy's next level. And it's very similar to what I do. So you get that.
Yeah, no, absolutely. And it's really interesting. You hit on the epigenetics and and being able to really kind of dive a little bit deep into the genes and the sequences. And it's kind of like where everyone, the genes are really kind of the piano, if you will. Whereas, all the things that influence the playing of the piano, all the variables, the nutrition, lifestyle, all the things that surround us, air quality, a lot of things will influence how that piano is played. And so that's why I love even if there's a predisposed condition, it doesn't necessarily mean that it actually gets played out in your life. We can actually mitigate the risk of it ever happening. And I love that that's your approach on taking the proactive approach rather than so much reactive, and there's so many different variables to testing and really creating that unique plan. And so that's one thing that when you and I dove headfirst into my personal journey of health, there's a lot of things where we had to take a look under the hood, and quite honestly, a lot of it was a little bit like, whoa, we need to hit our checkpoints. But the problem is I wasn't paying attention to the dashboard, right? And so now we had to go really look at some of the things that were under the engine, and then try to really resolve those issues. And so the same thing that you do with all of your athletes, same thing with with your clients and patients. And so it's a really awesome shift that you've taken with that medical model being rather than that reactive side, being so proactive with it, and the unique approach of being individualized is really where I think really the medical model should be going. If we can prevent, that would be amazing. Unfortunately, being preventative isn't on the forefront of a lot of people's minds, and especially as we're kind of in the climate now of dealing with really an unprecedented time with COVID-19. Let's talk about the elephant in the room right now. As a medical professional right now, how are you dealing with a lot of the current patients, or trying to be the leading edge on the proactivity side of COVID-19? What are we doing with your practice and what you're recommending to be preventative right now?
Absolutely. It's funny that you mentioned obviously the lack of proactive really recommendations, proactive attention. I'm big on looking for silver linings to anything, right? Mm-hmm. Things may not be ideal, but there's got to be some silver lining we can find. I think one of the biggest things is the silver lining of this whole pandemic is that for the first time in a long time, pretty much in my career at least, people are actively figuring out, look, this is going to be around for a while. Yeah. And we don't have a treatment and we don't have a prevention, but we do know that the younger, healthier people, or people who are more optimized, are without a doubt having better outcomes from this. So guess what? Maybe it's time for me to get in line, right? And people are actively seeking out ways to do this, and I commend them for that. And it's hard because gyms aren't open right now yet, and we are having to eat at home, and we're having to spend a lot of time at home, and there's a lot of anxiety around it. And so people are saying, look, okay, we get it. For the first time, we get it. The only tool that we have in our toolbox against this thing is keeping ourselves as healthy as possible. And so it's been cool to see that, and I hope that healthcare in general takes that and runs with it, because if there's ever been a time we've needed it, it's certainly been now, and it's maybe the wake-up call that we all need. But to that point, right, how do we do that, and what do we do? And I think that, and we won't get into any kind of political discussion around this, but the thing about COVID-19 is it has turned political in a lot of things, and you got to look at what the media is telling people and what they need to be telling people, and different strategies. And I had a client text me right before this, and she said, I am so confused right now. I'm more confused than I was when this whole thing started. I'm hearing different messages across the board. What is the real deal, and what do I need to be doing right now? Testing's being rolled out, and we're seeing groups open up different restaurants and different kind of service industries, and okay, people are out and about now, and then all of a sudden numbers are spiking. Well, testing is also a lot more available too, and so you got to really look at the numbers with a trained eye and with some common sense and say, okay, we know numbers are going to go up. We got to look at mortality rates, which the more we find people with these antibody tests and these asymptomatic cases, the more we realize, wow, true mortality rate of this is a lot lower than we once thought. Right. It's certainly still hitting the high-risk people. We know that, it's the elderly, it's the nursing homes, they're still just getting ravaged by this because it's just so communicable, and it does hit those individuals hard. So, where we are, we're looking back, we're saying, okay, is the cure for this, or is the solution of this worse than the problem itself? And again, that's a big argument, right? We're seeing now people who are so afraid to go to the hospital to get emergent care they're dying from heart attacks at home,
Right.
and they didn't go to the ER because they were afraid of a virus. And again,
Right.
I'm not going to sit here and say it's the flu. It's a bad virus. There's no question about that. It certainly hits people differently.
Yeah.
But what we're finding is people are neglecting their health care and their medical attention because we're also worried about this virus. We locked down to keep our hospital systems able to handle the surge, but now our hospital systems are dying on the vine. I talk to my colleagues that work in the hospital or in a primary care office. Nobody's going to see them. Nobody wants to go to a medical facility right now.
Right.
So,
Yeah.
On another talking point, you see that medicine is going to have to evolve from this.
Yeah.
We're going to have to say, look, doctors can communicate with patients. They should be able to communicate with patients the way I've been doing for close to 10 years now. And we need to be able, from the traditional model, even the insurance-based model, which, I'm not, but those guys need to be able to be reimbursed for those kind of sessions, those strategy sessions, those wellness, those preventative sessions, and they have not been. And so there is some legislation coming for that. So hopefully that helps more towards that proactive approach that we talked about. But in general, people need to be able to have someone to guide them through this.
Yeah.
And it's hard because doctors in traditional training programs are not trained how to do that unless they go out on their own.
Yeah.
And it's hard because people are anxious around the uncertainty right now.
Yeah.
Certainly here we are in Texas, and we've got a lot of oil and gas people just sitting around wondering what's next. And anxiety with that, and what happens when you're more anxious? Well, you typically will either self-medicate with the to-go margaritas here that everybody's got now in Dallas, or they're not sleepy,
which is awesome.
And it's like all these things that we're trying to put in place here, or that are because of this, they're actually causing our immune systems to be more weak, right? So again, what's the number one thing we can do? Well, we can all sleep better. Well, okay, that just doesn't mean lay in bed for 10 hours and say, okay, great, I had good sleep, because it's all about the quality of sleep.
Yeah.
People always ask me, how much sleep should I get, right? But we actually care about what quality of sleep are we getting. That's the question we should be asking. Some people do fine on 5 or 6 hours because their percentage of deep, restful, restorative sleep is so high.
Right.
Some people may lay in bed for 9 hours and get maybe like 10% REM or deep sleep, and they wake up feeling like crap the next morning, right?
Yeah.
So that's one thing we're working on a lot with people. And, if you got to understand how the body and the brain get ready for deep sleep, we've got to have a period of time where what we call our parasympathetic, as you know, our rest and digest, which is directly opposed by the fight or flight, right? Our sympathetic nervous system. We got to have that nice balance at the right times of the day, right? We need the surge in the morning to get us going, but we don't need that at night before we go to bed. So there's all those things that will stimulate that. And then there's certain things that will decrease our deep sleep. And so, it's quality of sleep, right?
Yeah.
And the easiest way I can tell everybody is, look, take whatever you're doing, whatever goes on before bed. We need to have a period of time where there's about, half an hour to a full hour where there's no devices, there's no blue light emitting devices, your TV, iPads, your computers. And you need to get away from that, whether it's reading by candlelight, whether it's sitting in the bathtub with some Epsom salt and chamomile, which has both been shown to relax and activate that parasympathetic nervous system. Deep breathing, meditation, mindfulness strategies. Those are all things when over time and done consistently, they will train your brain to get into that deep, restful sleep state, and you'll get the most out of your sleep.
Yeah.
There's a lot of supplements out there that can help. And again, that's something that, people can certainly try out, whether it's magnesium, whether it's the melatonin in small doses, whether it's CBD oil for some. All those things are tools in the toolbox to be able to get there. They're not going to fix the problem if we're not doing all the underlying stuff right. But they're certainly tools. And so that's the number one recommendation, is focus on our sleep.
Yeah.
And it's hard right now.
Yeah, it's, and it's a tool that is a very underrated tool. I mean, listen, sleep is going to be, like Dr. Lyssy saying, is our key ingredient to being regenerative. And that's a time for all of our cellular recovery to happen. And quality sleep is paramount because we're trying to recover so well, and we're also trying to, mitigate our stress levels. And so when we're in that fatigue state, and then we wake up and we didn't have that quality of sleep, you hit on something a little bit earlier, talking about being a little bit of the immunosuppressed, where we're not exposing ourselves to different viruses, but we're also, we can take some steps to increase our ability to have a better immune response. So let's take a little step back on this, Dr. Lyssy, and in a very elementary way, help us to understand a little bit, what is the virus? What does it look like? You hit on the, transmission of it. How is it transmitted? And then really, you also hit on as well is if there's underlying medical issues, who is really going to be susceptible to it, and then how can we as healthy individuals, once again, let's carry this forward, but really as healthy individuals, continue with sleep and then mitigating stress. But number one, what is COVID? What is the virus, and how is it transmitted?
Yep. So COVID-19 or SARS-CoV-19, I mean, this is a coronavirus, which is a type of virus, and we've actually had many, many coronaviruses over the years. The coronavirus and rhinovirus are two of the viruses that would cause the common cold. However, this virus is a little different, and it's obviously more infectious. It's more contagious. We focus on a certain value that looks at the contagiousness, meaning how many people can one infected individual spread to, and it's very, very high with this virus, which obviously makes things like, large groups or close contact quarters, whether it's your nursing homes, your prisons, your college dorms. That's how it's spreading very rapidly. The number one reason why I think the city of New York just got bombarded with this, other than people living on top of each other, if you've ever been on a subway in New York, you know how hard it is to stay away from somebody. I mean, that's just a breeding ground for this, right? So that's why you have these cities that have these mass transit, high utilization of mass transit with these huge spikes. You can see it all over the world. So the virus itself, and again, most like every other virus, it's self-limited, meaning not like a strep or a ear infection where it's bacterial and you can treat it with an antibiotic. We don't treat viruses. We don't really have a treatment for virus, and that's why this is difficult, because there's nothing we can give you to eradicate it once it occurs. Unlike the flu virus, and a flu virus is the same. Even if we give you Tamiflu, it shortens the duration and the severity of your symptoms, but it doesn't eradicate the virus. The virus is self-limiting, which means that over time, after replicating in the body and doing all of its damage, it will just die out. And that's how viral life cycles work. And so this is no different. The problem is this. It takes a long time for it to go away. Some people have asymptomatic cases. Other people, they get hit with it, and they get hit with it hard, sometimes 20, 30 days of high fevers and muscle aches. Certainly we know the cough is really bad. It attacks the lungs quite a bit. We know that there's a specific receptor in the lungs that once this gets into, it can wreak havoc. And certain people genetically have more of these receptors, which are the ones that have worse outcomes. And so the hardest part about this is, okay, great, you've got it, but what do we do? Well, we just sit around and hope that you can fight it off. Back to your immune optimization. Early on, when all this started getting crazy and sports started to get shut down, you saw that NBA players, actually, there was a lot of this going around the NBA. Every one of those guys didn't even hardly know they had it. They didn't have any symptoms, right? Well, what does that tell you? Some of the fittest, most cardiovascularly fit athletes who take really, really good care of their body had little to no symptoms, right? So just because you get this doesn't mean it's a death sentence. The healthier you are, the more you're going to be able to fight it off. And again, that is your best weapon against this. It's your best weapon to prevent you from getting it, or to have one of those asymptomatic cases, which we kind of all hope for if we're going to get this. Vaccines, we don't have a vaccine for this. They're certainly developing it as fast as they can. The question is, how effective is it going to be? How soon is it going to be here? And more importantly, what's the downside of rushing this to market without full testing? That's one of my biggest questions on this is, look, everybody's looking for it. Everybody wants it to get here fast. But how do we know it's not more harmful than the virus itself, right? So I think that's the biggest question with anything. Treatments, we had a lot of potential treatments that we thought may be great and wonderful. And obviously you've heard of the Plaquenil or it's hydroxychloroquine. And, there are a lot of doctors who are still using that. And, that doesn't treat the virus itself, but what that does is it affects viral entry into those cells we talked about in the lungs. And that's one of those things that, we still don't have an answer. There are a lot of doctors who anecdotally are using this without clinical evidence and saying, look, it's working. We're not having anybody die when we put it on them. But then the studies that they looked at where they gave it to really severe cases in the hospital, it doesn't really do much. So we don't have a great question, or we don't have a great answer to that question. There's a antiviral remdesivir, which is getting a lot of publicity, and it may be a great treatment for it. It was an old Ebola medication that didn't work for Ebola, but they tried it for this, and it shows some promise. It's an injectable med. It's hard to get. It's expensive. So, we're just not quite there yet. And there's some other things that may come down the road. So again, your best bet is keeping your immune system in tip-top shape.
Yeah, I mean, talking about a simple measure, we're taking a look at now different states and are kind of having a whole re-entry into, different businesses. And, now we're able to play golf and, kind of get back into a little bit of norm, which is interesting because, golly, I guess it was about 7 to 8 weeks here in Dallas, and I had to make a trip over to a store, and there was just tons of people, and taking all the preventative measures with the face mask, and obviously keeping the social distance. Mentally, I was super fatigued from just being around a lot of people that I hadn't been around in about 7 weeks. But is social distancing working? What are some of the things where we take a look at New York and high density populations? The transmission is very easy. Obviously, if I'm sneezing or coughing or something like that, the transmission becomes a lot more swift. But if I am cognizant of kind of my surroundings, right, and should we be afraid if I'm going to the grocery store? What's the likelihood of me getting it from touching an apple that somebody else may have touched?
Yep, great question. And the whole idea now is, okay, we want to keep people away as far as possible from each other, right? 6 feet is the number that arbitrarily everybody started using. Well, that's essentially how far respiratory droplets can travel when someone sneezes or coughs. Basically, 6 feet away is going to decrease the risk of someone transmitting it to you inadvertently. What we do know, though, is that all these asymptomatic cases, those things can be mitigated by that individual wearing a face covering that then allows anything that they have that they may not know about it to not then be transmitted to other people.
Right.
So I think with that, what we find is that, look, if we're going to get people out and about, we're going to try our best to stay 6 feet away from people. And then if that somehow doesn't work, or even with that plus the combination of our face mask is going to be something that's going to help. We used to think that, well, we didn't really think this. We wondered if this was going to be what we call aerosolized, meaning that, hey, once it's in the air, it can travel from room to room and it can travel over big distances. We haven't seen any data that suggests that, which is good. Otherwise, I think it'd be way worse than it is.
No doubt.
And so we really feel that the social distancing is certainly working. Now, you mentioned, okay, what if I go and touch an apple that somebody had touched that has it on their hands? Well, this thing can be transmitted through respiratory droplets, as I mentioned. If someone sneezes or coughs, and then it gets in your eyes, in your mucous membranes in your nose, or in your mouth, it can definitely get into your body. And that's how it's transmitted most often. But a lot of people will touch items, and then they will that has it on it, a surface that has it on it, whether it's a doorknob, whether it's a table, or whether it's a chair, whatever. And then they'll touch their face or their hands or their mouth, and the hands in their mouth, and that's how they get it in. So I always tell people, look, when you go out to the store, yes, you may touch stuff, and you don't have to wear gloves all the time. If you got it, great. And want to, fine. The problem is just because it touches your hands, it's not going to get in the body. But when people start to adjust their mask or rub their eyes because of allergies or, whatever, scratch their nose or, bite their fingernails or put their hands in their mouth, that's when things happen. So if you go to the store, when you go to all these places, and you touch things, just because you touch something, if you touch a surface that may have it, you're not going to get it unless you get it into your body. That's why diligent hand washing, alcohol gel with greater than 60 or 70% alcohol is going to be best. And that's how we do our best. And that's the answer I tell my patients. I'm like, look, we can't live in fear for the rest of our lives. This thing is not going anywhere, right? Now, you're 85 years old and you have immunosuppressed condition, right? That's a whole different ballgame. And those people, I feel, need to be extremely diligent and flat out self-lockdown just to protect themselves, right? We have to protect our most vulnerable, and that's how we do it. But when, you or I or other healthy people go out, I mean, that's something that has to come back. I mean, we need people moving. We need our economy. We've got to get back to work. And when that happens, we have to be very responsible. We have to wear our face coverings, even as much as we all hate them. We got to wear them when we go out. It's not protecting us so much as it's protecting everybody else. And that's the whole point people don't quite understand. They're like, well, I'm doing temperature checks. I'm not having any symptoms. it doesn't matter. We see so many of cases that are asymptomatic, and those are the guys and gals that are spreading it around without knowing it inadvertently, and that's how this thing is so hard to track. And so, if everybody that had it knew they had a symptom, flu, if you cannot have an asymptomatic case of the flu, right? If you have the flu, and you know to stay home. Pretty simple there. That's what makes this so hard to track and trace. But yeah, it's common sense goes a long way. Look, if I go to the store and there's tons of people there and the lines are crazy, look, maybe go in an off hour. I don't know what sports are going to do right now. Obviously they're working on coming back with no fans. When is it going to be safe? We don't know until herd immunity takes over and or a vaccine that's effective is in place. We may see sports that just either don't happen or are played without fans. I tip my cap to the PGA Tour. They just released their back to safe competition memo yesterday. It was a 37-page PDF. They sent me, and I read every word of it. It's very responsible in what they're doing. They're testing players, caddies. Nobody else is allowed there. I talked to one of the coaches for some of the players. He's like, look, everybody can have a coach there, and there can be one physio there to work on acute injuries. But the days of having your trainer in the gym and your entourage of 7 people on the range behind you and walking inside the ropes and practice rounds, families aren't even allowed on tour now. So it's really it's interesting. And I tip my cap because look, people need sports. I think it's great, and I think that golf is one of the things that you can show it's the safest of all sports. You're outdoors. There's not a lot of social contact. You can stay 6 feet away from everybody very, very easily. But what about all the other sports? So that's what's going to come down the line.
And it is interesting. I think, with the PGA coming back, obviously they have a very big responsibility to set the bar for all the other professional sports, and tip of the hat to them. And, I know they've been diligently working on all these, guidelines and safety plans to implement play again. But they really have a lot of weight on their shoulders to set the bar for Major League Baseball, NBA, a lot of the, different type of contact sports down the road. So it's going to be really interesting to see, number one, like you said, sports is important for a lot of people. Just to simply have, now we need a little bit of distraction on Saturday, just to simply watch a sport would be nice. But without the fans and, with their steps that they're taking, it should be interesting to see how it plays out for all the other sports. And so speaking of sports, obviously this is one of your huge passions. You are enthusiastic about being active, and you're into sports and you play sports. We both of us work with athletes, and so let's go down the performance track a little bit. Obviously we touched quite a bit on sleep. And why why sleep is so imperative to start to build the immunity response, but also, why is sleep, so important just even from a performance standpoint? Lack of sleep, we can see it. There's a lot of different wearable technologies that we use. A lot of my guys are, using Whoop and a lot of these wearable technologies where we can start to track a lot of the analytics that are very important to start to see the quality of sleep. And how it dictates the volume of work that I put in that next day, or do I have to kind of throttle down a little bit and not put as much strain on the body? So let's talk a little bit about sleep and performance, and how you see the impact of lack of sleep impacting the performance side.
Yep, absolutely. It's really cool to see the data that we have out there. You mentioned one of the wearables, the Oura Ring, OURA is another one I really like. Bottom line is this giving the athlete and their performance staff, their performance team, a way to truly quantify objectively how that sleep was as from a quality standpoint, and then what do you do about how, as you mentioned, the training load for that day. We've all who train in anything have had days where we just don't have it. And, you start looking back and you're like, okay, well, last night's sleep was pretty good, but what about the night before, right? These things are cumulative. Well, what's going on truly in sleep that allows us to get to where we need to be? So we, as humans, every cell in our body has mitochondria, and everybody remembers this from high school biology, right? What is it? It's the powerhouse of the cell, right? What does that mean? we produce ATP in your mitochondria. Well, where do you have the most mitochondria? Well, we have them in our muscles and our brain. Well, mitochondrial dysfunction is one of those things that, it used to be kind of this buzzword and people didn't really see it, but we now have data and we see in athletes and we see it in the general population. When your mitochondria don't work as well as they used to, you can't produce as much ATP as you need to, and you start having symptoms, whether it's fatigue, lethargy, whether it's lack of focus, whether it's muscle breakdown. My athletes will see that they can't perform. Their ball speeds aren't as the swing speeds aren't up, right? Their times on the treadmill, their output, all of these things are early signs that our mitochondria are starting to wear down. Well, sleep regenerates those mitochondria and it keeps the mitochondria working well. And one of the things that it does, and we just discovered this relatively fairly recently in the last 20 years or so, which I think is extremely recently in the medical world, considering sleep is the thing that we've done, everybody on this planet, every organism sleeps at some point.
Right.
What we found out is that along the channels in the brain, running just lateral to our blood vessels, there's these channels, these little drains, they're like little gutters. We know that all across the body we have what's called the lymphatic system, Lymphatic. But in the brain, we have now recently discovered this glymphatic system, that's Glymph. And so that is only, those gutters, those drains, those brain drains, so to speak, are only active when we reach our deep, restful, restorative sleep states, right? Our stage, our high stage, and our REM. And so we just recently discovered that those channels really only get activated and open up and start draining the brain from the toxins when we get that restful, restorative sleep. So if we, have stimulus right before bed and we're on our phones and checking emails, or we're up looking at our phones in the middle of the night, you never get to that state. You never, clean out the toxins that build up in your brain, right? And it's just like exhaust in the car. You put the old potato in the tailpipe, right? That ain't going to work, right? You got to get that exhaust out of there. And that's what the brain drain or this lymphatic system does. And so when we don't do that, all those toxins build up, and then those mitochondria don't work the way they need to be. And then that spills over into the body, and everything starts coming downstream in the wrong direction. So that's one of the reasons why sleep is so important. We have the ability to, our bodies are beautiful in that they regenerate. And they have this self-cleaning oven feature called autophagy, which the discovery of it won the Nobel Prize in Medicine a few years back. And this, as I like to call it, a self-cleaning oven feature of our cells is just that. Once we activate this autophagy, every bit of, dead and dying or less efficient cellular particle gets cleaned up. And that's how we perform beautifully. And when we don't do that, we're going to have suboptimal performance. But what we also see is we see that rapid the aging or hasten the aging process. And so from an anti-aging and a longevity perspective, Dr. David Sinclair out of Harvard Anti-Aging, Dr. Walter Longo out of USC Center for Anti-Aging, these guys are all about how can we activate this autophagy to get our body cleaning itself better. Right. And from an athletic standpoint, that is exactly what our athletes need to be doing. And so sleep is the best way to do that. Then we talk about nutrition and the foods that people eat, and food is information for our body, and everything you put in your body, we can talk about macros or calories, but I think that's kind of old news. I think that the new way to look at it is what hormonal response is created when you put food in your body? What genes are turned on and off by the micronutrients in the foods that we eat? And so that's really the fun part, is getting with these athletes and really kind of diving into what they're eating. And I remember in college, I ran pretty competitively, and I'll never forget right before a race, what did I eat? Like an old power bar. And if you look at what was in that, it was a bunch of simple sugars, complex carbs, and a bunch of other buzzwords, and a bunch of frankenfoods. And it was like, man, I wonder what I could have done with proper nutrition, And it's just kind of the way it used to be. It was the big push around, well, let's create the new latest and greatest packaged food to give an athlete. It's not the way to do this, right? So nutrition is big, and really diving into nutrition with these guys is important. I think supplementation, supplements kind of get a mixed bag in a lot of circles. And I always tell people, look, if I'm going to put you on a supplement, it's going to be because we can't get that through our whole food nutrition, right? We talk about longevity and anti-aging. Two of the best longevity supplements that have been widely proven, resveratrol and a supplement called nicotinamide riboside that actually helps with that mitochondrial system to produce ATP. Both of those, I mean, the only way to get enough resveratrol is to drink about 6 gallons of wine, which, hey, some people may have tried through quarantine.
Yeah,
but
it's
again, it's easier to supplement that, right?
Yeah.
And so same thing. That's what I look at is, look, if we're going to supplement, it's got to be because you're not going to be able to get enough through whole food nutrition, right? And that's how I look at supplements. And so I figure out who needs what, and we look at what our goals are, and we'll supplement as far as performance there.
Yeah.
And then finally, a great partner like yourself to say, look, okay, when we get all those things in place, and when their nutrition is on point, and when their sleep is on point, now, Damon, do your work with them, right? And get your game out of them. That's when they perform best. And you can probably, before you had all these wearable data points, you used to be able to sense that with your clients, but now you can see that, right? And so it's got to make you just so much more beneficial to them, because you can use that data now to say, all right, guys, hey, I don't know what you're doing, but you've had 3 off days in a row here, and your recovery levels are low, and I can't just sit here and put you on the bike and let you spin it out. So we got to figure out why, because you're delaying your progress from this. And so I think that's cool to see how you use that data and how it holds them accountable, right? If they want to have that nightcap before bed or that one extra glass of wine, once you start having that data, you start to see, okay, I know for a fact I have that extra glass of wine or that nightcap after 9 p.m., my deep sleep goes down by a half. And that's just going to catch up with them, right? So it's those little things that hold them accountable for their own actions, and I think that's motivating.
Yeah, and it's interesting to start to see the entire cycle of that. When even if we started with the entrance ramp of lack of sleep, and then obviously the symptoms are going to be the fatigue piece, and then energy output. But a lot of times, shoot, man, when I'm fatigued and when I'm I have lack of energy, we always kind of sway towards those foods that are going to be kind of more sugary, more just processed, and then we start this vicious cycle of really diminishing our gut health. And then what happens with our gut health? There's direct linkage between the gut and the brain axis, and so now we start to see these cycles that start to happen, especially when we're already kind of mentally bogged down with a lot of unknown right now. We fall into that cycle of lack of sleep, stress increase. Well, I'm going to gear towards a little bit more of the sugary foods, a lot of alcohol, a lot of the processed foods, and then we just start this vicious cycle of kind of a declining performance level. And so what's really interesting is, like you said, is being able to track that and to see, okay, what does a little nightcap do to my recovery ratio? And if I'm not recovering well, maybe we need to step away from the alcohol. It's basic information, but now there's data to prove it, where we go, hey, listen, we need to mitigate the sugar intake. We need to obviously lose the alcohol. We need to actually increase the hydration. They're very simple points and simple tools that we can equip ourselves with. But now, once again, with a little bit of the technology, it supports going, hydration levels, once we're optimally hydrated, look how sleep and energy output, everything starts to increase in terms of your recovery. And so that's a really key component is, in our world, is recovery is key. And the quicker I can recover from a high day of stress, then I can start to perform optimally on a day-to-day basis. And so that's where, I like unraveling every piece behind the puzzle. Is like, listen, let's attack it from the nutrition, let's attack it from the sleep, let's attack it from the stress side, but let's talk a little bit about the mental side. A lot of us are probably dealing with a mild level of depressive state right now, and what are some of the tools that we can use right now to kind of get us out of the funk a little bit. Once again, we don't know what everyone's dealing with, but, listen, you have kids, I have kids, we're doing homeschool, we're dealing with a lot of the unknown piece. And there may be just a mild level of that, depressive state, or, a lot of people are dealing with a lot of the major depression as well. So let's talk a little bit about the mental capacity, how we can start to mitigate a lot of that. And, the stress and depression are linked, one together, but how do we take those steps to really kind of enhance our mental capacity?
Yeah, and it's so important, and unfortunately, it's so prevalent right now. I think more than anything, especially during kind of the COVID pandemic, right? The first week, I'd always get calls. Okay, I've got a runny nose, do I have COVID, right? But then once that settled down, the calls I consistently got is, hey, I need something. I need a medicine. I need, some Xanax. My anxiety is through the roof. I'm more depressed than I've ever been. I don't know what to do. And so, that's when I would really get a great time to stop them and say, okay, let's look at everything. Let's look at what you're doing from your wellness strategies. And when I really dug in deep, I mean, everything that you mentioned was thrown off. Their sleep was bad. Their nutrition was terrible. They had all the time in the world, but they were so worried about everything. They just didn't go out and do stuff. They didn't exercise. They were not active. They're sitting around and binging, Netflix, right? Tiger King or whatever. And so it was like all of these things, these opportunities that were presented, they would have allowed people, if they could have, to say, look, let's go and let's make the most of this. Let's spend time with our family. Let's practice gratitude. Let's go be active. Let's be outside. Let's take hikes. Let's get back to nature. And some people did that, and they're seeing that they're thriving in this situation. But a lot of people hadn't. And I think those things right there. The first thing is it's an unknown. It's an uncertainty. You alluded to that. We have zero control over it, right? So I think the first thing most people, and full disclosure, look, I'm not a therapist, I'm not a psychiatrist, but I have done this so long, and the mind-body-spirit connection is so important for overall health. I kind of have to have a little bit of this too. And so, and that's one thing I work on with myself all the time so I can be a better provider. But what we find certainly is that when you have someone who has an uncertain situation, the only thing that we can do is say, look, I have no control over that, but what I do have control over are X, Y, and Z. And the more that I do that, the better off I'm going to be. And every day is going to be a little bit better than the last. And then gratitude. Practicing gratitude has been physiologically shown to balance out that sympathetic and parasympathetic activity that we talked about earlier. So I tell people, look, things are wild right now. Things, oil is negative. But you got to understand there's a lot we have going for us right now. And you know what? You have your health in a situation where you have a global pandemic and people are dying, right? So there's always something that we can be grateful for. And the more we practice gratitude, the more our bodies are going to be in balance, right? So, the first thing certainly is knowing what you can control, controlling the controllables, right? Your thoughts, your actions, decisions, your emotions, your attitude. Like, it's the same thing we tell athletes, right? But it happens on a day-to-day basis. Control your controllables. If something's out of your hands, you cannot give it attention. Don't feed that wolf, so to speak, right?
Yeah, for sure.
But practice our gratitude. The other thing too is take up a hobby, find something new. And this can be something you don't have to, dive into learning the guitar or anything. We don't have time for that right now as things are being juggled. But what you do have time for is 5 to 10 minutes every morning and evening to do one or both things that I find extremely centering. And one of those would be meditation, right? There's 10,000 apps out there now to help you with guided meditation. My favorite is Headspace. Headspace is one of those
every day.
That's fantastic. Yeah. And, there's the Calm app and there's Simple Habit. And all of these things will allow people to sit there, pop their iPad or their AirPods in, relax, and they'll just walk them through a guided meditation. And what we have to understand about meditation, a lot of people have this connotation that, oh my gosh, that's some weird, hokey pokey thing. But what the idea of meditation is it's being present. And it's focusing on something like your breath that's always there. And the act of deep breathing actually activates our parasympathetic nervous system, which we keep coming back to, right? That's what we have to have in balance with our fight or flight. And so that meditation is one of the things that can absolutely help, both from a mindset, but as well as physiologically to help control anxiety. And, the first time someone does it, they're going to say, oh my gosh, this is terrible. My mind wandered 100 times. But that's actually good. That's like a rep. That's like a mental rep. Every time your mind wanders and you bring it back to the present, as you know, that's one of the things that can help. And it gets easier over time. And nobody's perfect. Nobody will ever sit there and meditate without their mind wandering, but it's the act of getting it back. And it actually can you feel so good after a meditation, it's almost addicting, right? And that's exactly what we're going for. Because what we want to do is we don't want meditation to be an app on our phone that we kind of slide into when things get crazy and close it out. We want to kind of live in that operating system. We want to, when things get crazy, we don't want to have to think about it. We want to start deep breathing and slowing our breathing. That's going to train your body to do that on a day-to-day basis. And over time, that's going to perform better than almost any anti-anxiety medicine or any antidepressant out there.
No, absolutely.
So that's another tool in your toolbox that people can really start to implement and train themselves to do right now.
Yeah.
One thing that I've picked up through this is journaling. I think journaling is a phenomenal way to practice gratitude. I think it's a great way to be centered, to be present. And I think it's cool to look back and say, I'm big on any kind of commitment and saying, look, 5 minutes a day, I'm going to journal. Mm-hmm. And when you start back after about 6 months, you're like, wow, look, sometimes you brush your teeth every day. Hopefully you make your bed every day, hopefully, right? But like, other than that, like, what do you do every day? When you have something like that, you can go back and look. It's kind of motivating. You say, all right, great. And it stimulates further progress in other aspects. So I think meditation, mindfulness, gratitude practice, journaling, those are great ways to do it. And then, being outdoors, being outside. One thing I love seeing on your Instagrams, you're always outside with the boys doing stuff I grew up doing before video games were a thing, right? It was like you went out, you looked for turtles, and you went on walks, and you went on hikes, and you're taking them to really cool places to see things that most kids don't even know exist right now. And it's so simple, but it's so beneficial for you being with them, being with those who you love, and then certainly just being outdoors and grounding yourself and just seeing the beauty of nature. And so, all that stuff, I know people look at that and they're like, well, I don't have time for that right now. And you may not, but there's time for little things, and there's time for being able to put those little interventions in there and really make big progress on this.
Yeah, and it's one of those things where, those are, huge tools in the toolbox to use, and we hear it all the time. And, a lot of people will say, I don't have time to do that. And then, it's a easy rebuttal to say, well, we also don't have time for illness down the road. And so if I can take the steps to equip myself to, feel better, sleep better, be able to recover faster, and really just navigate these crazy waters that we're in right now, and just to be able to, I always love the whole Bruce Lee thing is like, be like water, as I can control the variables of my nutrition and my sleep and, meditation, click all those right boxes. But you know what? Something's going to bump us off the road, but having the ability to stay fluid and be able to stay focused on, I am going to control the variables I can control, and the little things that are the external variables, I just need to be like water and be fluid through that process and not be, overtaken by this massive wave that's coming over me. I think by, being very repetition oriented and saying, listen, I'm going to try meditation for 5 minutes a day. I'm going to try to journal 5 minutes a day. And that starts to expand every single day, because we start to see the benefits of that. Even simply just taking time to breathe and be present. It's really interesting. Like you said, I love to take the boys out in nature a lot. For a simple fact is, listen, the grounding effect of just simply being able to touch nature. We've lost the ability on that with a lot of video games and a lot of just technology like this. Is we're in a technological world where we lose the ability to simply just touch a log and touch grass. There's power behind that, right? And so the things that I can control are going to be imperative to really equip ourselves, and that's essentially what we're talking about right now, is just how do we equip ourselves through a little bit of this crazy waters of the COVID-19 and the economy and all this stuff starting to kind of take us into turbulent times. Now, how do we navigate that well? So I appreciate you giving those tools, and you really equipped us well today, Doc. And I appreciate everything that you're doing, from equipping everything from your patients to shift the mindset to be proactive in everything that we're doing, not so much reactive. And I think that's really the encompassing thing throughout this time, is let's be proactive during this time and do the things that we can do, even if it's very small. And once again, it kind of is the theme of everything that we're talking about, right, Doc? It's just that one simple step forward, one simple step to do the right things. And so, Doc, how can people find out more about you, and how do they follow you? How they find you?
Yep. So my website is www.drlyssy.com. That's DRLYSSY.com. There's a link to my Instagram, which is Dr. Lyssy Wellness, at Dr. Lyssy Wellness. And we'll post different wellness strategies on there, as well as some updates as things come along. And I have a lot of people that interact with me on there, and they'll ask me specific questions. And I've been on a lot of podcasts and a lot of Instagram lives throughout all this, and just kind of helping people navigate the water, so to speak, and giving them updates as we get it. And so those are great ways to do it. And if anybody ever wants to schedule a consult and do more work with me. I actually work with people all over the country, and we have the ability to get labs anywhere. And so it's not just for people in Dallas. I have a lot of clients that are all over the states, and so it's really enjoyable to work with someone who is very passionate about their wellness. And how that is. Your guys are that way, and it just makes you look better when you get the benefits down the road for everybody. It's great.
Well, Doc, I appreciate your time today. This is an awesome one to take a lot of nuggets from, and I appreciate everybody listening, checking in on the, Facebook Live piece as well. If you're listening to the recording, I appreciate you guys coming back on the recording. And listen, we just gave you some tools to simply just be able to keep moving forward through these times of turbulent waters. And now we have the, equipment to help us really navigate those, turbulent waters, but also just staying fluid. And so, as with the theme with the Forever Forward podcast, just always keep moving forward and always maintain that mindset of being forever forward. Appreciate you guys. Take care and be healthy.
Thanks, Damon.